Hi and hello everyone, welcome to the Nursing Virus YouTube channel. This is me Logunathan. This video regarding the AIIMS NORCET 2020 Nursing Officer Examination which was held on the date of 8th September 2020. So the questions which I am going to discuss, that everything based on the memory. So in the evening shift already have uploaded 3 parts under that 110 question. On this part I am going to discuss the furthermore 20 questions from the evening shift. And as well the kind request for that audience, if you are written the nursing officer examination, the NORCET 2020, either in the morning or in the evening shift, if you remember any other question, you can inbox to my WhatsApp number or you can write it in the comments box and mention it, the question belongs to which shift. So that can help other students to learn and to verify their answers. And here if you are going to my video list or the playlist, you can see the furthermore videos from that AIIMS NORCET examination, the memory based questions, around 6 more parts I have discussed. You can go and watch. And so far if you are not subscribed my channel, don't forget to subscribe and click the bell icon just below the video so you won't miss any other videos from my channel in future. Here we'll go with the today's discussion. So the first question belongs to the aptitude side. The online sailor sailing the bag in the online at the price of 2000 rupees. With that already 20% of discount, and after placing the order he gives additional 10% discount. So find the actual sailing cost of the bag. So what they are asking, what is the final price they are asking in the question when it is reaching to the customer. So the initial price is 2000 rupees. From the 2000 rupees they given 20% discount. So that means from that percentage we need to convert into the rupees. So that can be done in this way, the 2000 into 20 divided by 100. So you will get the 400 rupees as an answer for the 20% discount. So we need to minus from the 2000 rupees. So you will get 1600 rupees after making 20% discount from the actual price. Then the person providing furthermore 10% discount after placing the order. So again the 10% we need to reduce, that is 1600 into 10 divided by 100. So you will get 160 rupees as a 10% discount after getting the 20% discount from the initial price. So again we need to minus 160 rupees from the 1600. So you will get 1440 rupees as the final price of that bag when it is reaching to the customer. So the next question. So after completion of open abdominal surgery, the OT nurse need to do which of the following activity first before making the suture? According to the priority they asked in the examination. So the first priority goes in this way, that is checking the sponge count and instruments count before suturing the opened area. So the next one again belongs to the aptitude side. Identify the next number in the sequence. They given the numbers, the 5 numbers they given, that is 1, 2, 4, 7 and 11, and they asked to identify the next number. So here just an common thing only. We need to identify what is the difference between one digit to next digit, and just we need to perceive ourselves. Here the simple trick. So here between the first and second number we have the frequency is 0, and between that second and third number that digit left is 1 digit number, that is a 3, and between the 4 to 7 the 5 and 6 were left, so 2 numbers were left, and between the 7 and 11 the 3 numbers were left. So here you can see the relationship, that is starting from 0, 1, 2 and 3. So what is that next number gap we need to keep is 4. So from the 11 we need to add 12, 13, 14 and 15. The 4 digits we need to add, and the next digit number is 16. So our answer is 16. That is the next digit From that 1, 2, 4, 7, 11 and next digit is 16. So the next question. The oral contraceptive pills, that is OCP, will be given after how many hours of unprotected intercourse? Commonly, within 72 hours, if you are administering the oral contraceptive pills, that will become much effective. So the next question. The triple test performed at the week of 15 to 18 weeks during the pregnancy period. What is the positive test result indicate that the baby having Down syndrome? So actually, the triple test will be performed to identify the chromosomal abnormalities. Here, the correct answer is the maternal serum alpha fetoprotein and unconjugated estrol will get low, while going with that human chorionic gonadotropin getting high, were mainly indicating that the baby is having Down syndrome. So here I given the other names for the triple test, that is the triple screen, Catering test and Bard's test. These are the other names for the triple test. So the next question. A type of pattern of fever in which after every 24 hours the body temperature comes to the normal level is known as, that is commonly called as intermittent fever. So the next question. The client blood pressure is 90 by 60 mm of Hg and intracranial pressure is 18 mm of Hg. So find out the cerebral perfusion pressure for this client. So just they given the blood pressure for the patient and as well they given the intracranial pressure. So they asked to find out the cerebral perfusion pressure. So here we have a simple formula to calculate the cerebral perfusion pressure, that is cerebral perfusion pressure is equal to mean arterial pressure minus intracranial pressure. So here what the value we already knows, that is the ICP already we know, and we need to identify the mean arterial pressure. Here we look out how to calculate the mean arterial pressure. Again we need to know the one more formula, that is a systolic blood pressure plus 2 into diastolic blood pressure, the total divided by 3. So this is the formula to calculating the mean arterial pressure. So here the systolic blood pressure is 90 and diastolic blood pressure is 60. So apply those value into the formula and you can get the value of the mean arterial pressure is 70. So now we got the both value from the formula, that is mean arterial pressure, that is 70, and that intracranial pressure already they given on that statement, that is 18. So if you are doing on the formula, you will get the cerebral perfusion pressure 52 mm of Hg. So that is the correct answer. So the next question. What is the immediate first aid management of chemical accident foreign body on the corneal area? So here the correct answer is clean the eyes with a plenty of water, or if normal saline were available, mean you can wash it with the normal saline. So this is the first aid management for the chemical accident to the cornea or the eye. So the next question. Which of the following behavioral therapy is effective in treating the patient with OCD? That is, OCD is nothing, that is obsessive compulsive disorder. So the correct answer is exposure and response prevention is the best therapy for OCD patient to relieve from the anxiety. For example, suppose if the OCD client having the fear of germs and repeatedly washing the hands mean, as a therapist, what we'll do mean, so we'll ask the person to touch in a certain place of that living environment and will not allow the person to wash the hands, and we'll try to make the person to control his anxiety. So here as the exposure, we are making the person to touch the certain environmental things, that is called as exposure, and the response prevention is, so immediately the person need to go for the washing of the hands to relieve from the anxiety. So we are preventing the response of the person, that is the washing of the hand. So the next question, again from the psychiatric, what is the appropriate nursing action for the female client who is diagnosed with a BPAD, that is a bipolar affective disorder? So the correct answer is establishing the clear boundaries. That is the correct measure for the BPAD patient. So the next question is, so what is the reason to perform Naloxone challenge test on the client with opioid abuse? So the correct answer is to check the level of physical dependence. So here we'll see how they are doing the Naloxone challenge test mean. Either in the IM or IV, the amount of 0.2 to 0.8 mg of Naloxone will be administered. The positive test is indicator of the physical dependence and consistence of typical withdrawal symptoms and signs of an opioid patient we can see. Those symptoms can be last for at least 30 to 60 minutes on the client. When the person were showing this kind of symptoms, we can check the physical dependence from this character. So the next question, the use of monopolar cautery and improper placement of the grounding electrode considered the cause of electrocautery burn. So here the correct answer is the monopolar cautery. Just they asked, so what kind of cautery will make the person to get the electrical burns. So on the next question, which of the following drug administration during the post-operative period will cause the patient to get nausea and vomiting? So the correct answer is tramadol. Suppose if they are asking to control the nausea and vomiting, we can write the ondansetron, but they are asked which drug will cause the person to get the nausea and vomiting. So the correct answer is tramadol only. So the next question, so the characteristic of breast cancer, the correct answer is non-movable fixed irregular mass can be seen on the female client. So the next question, as a nurse, you are finding emulsification of fat in the IV bag. As a nurse, what is your immediate action? So the correct action is changing the new bag of IV is very important. So the next question, what is the predictor of preterm labor? So the correct answer is fibronectin. So the fetal fibronectin is used to test the pregnant women who are between 22 to 35 weeks of pregnancy and are having the symptoms of premature labor. The test will help that predict the likelihood of premature delivery within the next 7 to 14 days. So the next question, which drug decrease the threshold of seizure? So the correct answer is administration of anticonvulsants. So the next question, the mesh which is used in the hernial repair surgery. So the correct answer is polypropylene mesh commonly used for the hernial repair, mainly the inguinal hernia repair. So the next question, 129, a pregnant woman with cord presentation in the obstetric room. What is the immediate nursing management the nurse need to do? Placing the patient in the Trendelenburg position is the appropriate and correct answer. And last question from this part, the image-based question, the X-ray of kidney, urethra and bladder they're given, and they're given along with the stones on the X-ray, and they asked to identify what kind of diagnosis you will make by looking the X-ray. So the correct answer is renal calculi. So that is the finding you can look on the KUB X-ray which they given on the NORCET examination on the second shift. And thank you for joining with me. And again, that furthermore request from the audience, if you are appeared for that NORCET examination, you can write whatever the question you remembering on the exam, either in the morning or evening shift. You can write it in the comments box or you can inbox to my WhatsApp number. And So far, if you are not subscribed my channel, don't forget to subscribe and click the bell icon just below the video. So you'll get all my video notification. And thank you for the positive support.